Welcome to TraumaticBrainInjury.com. TraumaticBrainInjury.com is the leading resource on the internet for resources regarding traumatic brain injury for survivors, families, and caretakers. My name is Stuart Cohen. Today's guest is Dr. David Lenro. Dr. Lenro is a physician who specializes in physical medicine and rehabilitation. He's on staff at the Hospital University of Pennsylvania since 1987, and he's also on the faculty at University of Pennsylvania Medical School. Dr. Lenro is involved in treating patients with traumatic brain injury as a regular part of his practice. Dr. Lenro, again, thank you for agreeing to appear on TraumaticBrainInjury.com.
Thank you for having me.
Doctor, on TraumaticBrainInjury.com, we've been talking a lot about brain injury and the consequence of it, the treatment and treatment options, symptoms, and so on. I'm wondering if you could provide for our viewers a way to navigate the brain's anatomy and function so that we could have some understanding of a little bit about the parts of the brain that are affected and what that means in a practical sense. All right?
Okay.
In terms of the symptoms, does it matter what part of the brain is injured?
Yes, it does, because different parts of the brain do different functions, and if that part is injured, a specific function is more likely to change.
We have a model there next to you, and using layman's terms, there's a front, there's a back, there's a right, there's a left. Can you kind of take us around the brain and tell us what parts of the brain affect what parts of the process?
Yes. In general terms, I could certainly do that. The interesting part with brain injury is that even though the impact may be in a particular area in the brain, the injury may be somewhere else, and that's something to certainly keep in mind as well. I'll try to lean over here, and this is a section through the middle of someone's skull, and this top part of the brain is the cerebral cortex, which in certain areas, and it's hard to see in this brain model, but about here there's a strip that controls motor function. So each part of the body is represented there that has muscles, and if you have an injury in a particular area, it can affect the use of one arm or one leg, and it's actually backwards. So the left side of the brain controls the right side of the body, and vice versa. This area here, the frontal area, the front of the brain, controls impulse, behavior, and higher level functions for the most part. So if you have an injury to that part of the brain, people become impulsive, they act differently, it can affect their personality, and it can have a fairly large impact on how someone behaves.
Problem solving, is that in that part of the brain?
Yes.
What about judgment?
Judgment is, and it seems to be in both sides, but judgment's definitely affected by the front of the brain.
So much of humanity, what we think of about human beings, is emotion. Is that also in the
Yes.
frontal lobe?
It's in the frontal lobe.
All right. Where do we go next on this tour?
Well, if we look at this little brain, or a little model, I should say, this is the outside of the brain. This is the front, this is the frontal lobe again, and here's the temporal lobe, which, again, serves a bunch of functions, memory being one of them, a common one that's injured, or a common one that's affected by brain injury, I should say. And back to the big model, back here is the occipital lobe, which is in the back of the brain, and we can see it on this little model as well, so it's back here. That serves as our center for vision, among other things, but that's probably the most important thing that it does that's often affected.
So if someone would have a brain injury in that part of their brain, their ability to see would be affected?
Yes, and their ability to interpret what they see as well.
What does that mean?
Well, we see, depending on how you want to define how we see, our eyes actually process that information to some degree and send it to our brain, and we interpret what our eyes take in. So in fact, on our retina, everything is upside down, and we flip it over because we know from our other senses that it's actually upside down. And the occipital lobe does some of those processing activities.
All right. Please continue.
This area back here is the cerebellum, and again, it's the back of the brain, and you can see it on this model as well. Here, among other things, it does fine motor control and coordination. So it may seem that you may at first blush think that coordination is not a terribly important thing for normal activities, but if you lose some of those functions, doing simple activities becomes very hard. So people can't sort of control how they walk or how they do motor activities.
Will that affect someone's balance?
Greatly, yes.
I'm sorry, please continue.
The next main section of the brain is the brainstem, which is, as it sounds, at the base of the brain and connects to the spinal cord. And on this model, you can see it here. It has several different parts. A way to think about that is that it's evolutionarily part of the primitive brain, so it controls some very basic functions, things that we think about as automatic, heart rate, breathing. It controls attention and some of those basic functions that if we didn't have, we can't survive.
All right. And if someone would sustain a brain injury at the brainstem level, that would be included in the severe brain injury category?
Again, it depends how much of the brainstem is injured or how severely it is, but yes, it often can be. And if it's a severe enough injury that someone's not breathing, if they're not treated immediately, they're obviously not going to survive that sort of injury.
Are any two brain injuries exactly the same? I mean, two people get hit in the left front of their skull. Is that going to be the same exact injury on those two people?
No. In fact, no two brain injuries are exactly alike, even with the same mechanisms. Just like people's personalities are different, their brains function differently, and their injury and symptoms will be different.
Is location? I know we've been talking while you've been taking on this tour of the brain that location is important, but is the cause of the brain injury, the severity of it, the age of the person, are they also factors that play into it?
Yes, they're very important factors.
So a blow to a child's head might be very different than a blow to someone who's much older?
Yes.
Does it matter which side of the brain is injured, left versus right?
Yes, I alluded to that a little bit, but the different sides of the brain have very different functions. So the left side of the brain will control the motor activity in the right side of our body, but also controls much of language, and the right side of the brain controls more visual spatial control, those sort of activities.
In other sections, Doctor, you've told us about the fact that there are sometimes personality and behavioral changes, even in mild brain injuries. Is that right?
That's correct.
And that they may not appear for a period of time. Is that right?
Well, they generally appear right away, but they may not be recognized for a period of time.
Right, fair enough. And why is that?
Again, it depends on the constellation of injuries to other parts of the body. But initially, when people, after trauma, seek treatment in an emergency room, they're looking for life-threatening injuries.
Now, in another section on traumaticbraininjury.com, you've talked about the symptoms that may exhibit themselves in mild and moderate brain injuries. If family members or survivors are seeing those symptoms, what do you suggest?
They need to seek medical attention. And, that would mean someone with some specialization in brain injury, either a neurologist, a physical medicine rehabilitation, generally not your family physician, although hopefully they can direct you to the right physician to go to. But it needs to be someone with some experience, particularly when it's a mild traumatic brain injury.
What if the family doctor is telling them that these are relatively mild consequences of a concussion and it'll go away with time, but the family is concerned about these symptoms. In that situation, what do you advise?
I would advise that they seek specialized medical attention.
Thank you, doctor.
Thank you.